episode of low back pain, it's hard to know what's the right thing to do. Should you rest or should you stretch? Should you ice or use heat? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and we see lots of people with low back pain, and sometimes they're not able to get in for treatment right away. So I'm going to give you a few tips to help you manage your low back pain at home before you can get in for treatment. First, you can try heat, either a heating pad or a hot shower. Heat is great for that spasm type of low back pain, the one where it feels like it's going to grab and give out. That helps calm the muscles down. Some people like to alternate with ice, so you might do 10 minutes of heat, then 10 minutes of ice, and then 10 minutes of heat again. The ice is going to dull the pain, and it might also help with some of that inflammation. In addition, pharmacies carry heat packs or patches that you can actually stick onto your back to keep the area warm and relaxed all day. It's also important to try and find a comfortable, pain-free position. Pushing through the pain is not going to help you here. So it can be difficult, but one position that can be comfortable for a lot of people with low back pain is lying with your legs up on a chair. Now, if you feel like you can't get up and down off the ground, you can do this on a bed with a stack of pillows instead of the chair. So you're going to put your legs up on the chair, knees bent, hips at 90 degrees, and you're just going to try and relax the low back. So taking deep breaths, imagining the low back expanding and stretching, and staying here as long as it's comfortable for you. Now, we no longer recommend bed rest for back pain. Now the approach is more of active rest. So you're going to modify your usual activities, but you want to keep changing positions. So you're not sitting for too long, you're not standing for too long, and you're taking movement breaks. So even as often as every 15 to 30 minutes, you're getting up and moving around, maybe even going for a walk around the block if that's possible for you. It's helpful if you can figure out which direction your pain is worsened. Now, for some of us, every movement you do is going to be painful. But if you just take a quick test and maybe lean back, oh, is that painful? Or is it worse when you try to go forward? Now, if you find that it's actually relieving when you go forward, then you might find that marching in the spot can be a helpful way to loosen up the low back. If you find that leaning backwards actually gives you a bit of relief, then you can place your hands on the flat bony part of the low back and just arch backwards, holding for about 5 seconds and then releasing. So I would repeat either or one or both of these poses throughout the day. You can also try tilting and tucking. So getting that pelvic movement helps stop the low back from bracing. Some exercises you can do either on the floor or on your bed. If your back feels better bending forward, then you can hug one knee into the chest, maybe both knees into the chest, trying to get the low back to relax. Now, if you felt better going backwards, you can try what we call a sloppy push-up. This is also potentially a good pose for people who get pain down the leg, but you have to go off of what feels right for your body. So lying on your stomach, you press your hands, lifting yourself up. In yoga, we also call this cobra pose, and then slowly lowering down. You can repeat this about 5 times, and again, doing this throughout the day to give yourself relief. If you're wondering about over-the-counter medication and what might give you pain relief, the pharmacist is an excellent resource. You can go and talk to them, explain what you're feeling, and they can recommend over-the-counter options, maybe even a topical pain-relieving cream that could give you some relief. Most importantly, get assessed. We can help you figure out what's going on with your back, what is the root cause, and then give you specific help and specific instructions about how to manage your problem. If you have any questions about anything that I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Friedman. We're always happy to help.